Thank you, Dr. Jefferson. So my name is Rachel Smets, and I'm an international speaker, I'm an author, I'm a YouTuber, and I really help people to shift their lives and really live the life that they desire and that they deserve. So I really truly believe that you can change your life. But this is all about eating disorders. It's a topic that is very near and dear to me because I've been there. So I know what I'm talking about. And eating disorders is very often known as being something for teenagers, whereas I had it as an adult. And I'm fully recovered, but there are definitely some tips and tricks I can offer to family and, of course, based on research. But I would like to do two things, and that is first give you a list of 5 items to avoid, because it's always very nice to say, hey, this is the best thing that you can do, but there's also a few very important things that you really should avoid doing. And so I'll first give the list of what not to do and then what to do. So things to avoid, things not to do. First of all, ask questions like, okay, so are you better? Like, are you better now? Like, they should like be in a hurry, like, come on, just get over it, right? So those are kind of, watch the questions that you ask. The second thing, trying to manipulate. Please, please, please try to avoid and manipulate. Like, oh, you're ruining the family, or, just do this for me, or just give it up for me. It's not about you. If you're a family member, a parent, or a loved one, or a sibling, it's not about you. It's really about this person with the eating disorder who's really trying his or her best to recover. So avoid this manipulation. It's not going to work. Number 3, make comments on appearance or weight. Like, please try to avoid that and not do that, because an eating disorder is all about how they appear. It is about, having a wrong image about your own body. It is about weight. So if you make comments on that, please avoid that. Number 4, avoid shaming and blaming. Like, oh, you just need to eat. You were hurting yourself. You're hurting me. It's like you. Like, point the finger at them. Don't do it. If you hurt yourself, then point the finger at yourself and say something like, I feel, or I am hurt, or I'm feeling this, but avoid pointing the finger to the person who's actually struggling really, really hard. So pointing the finger and saying you is not helpful. And then the last and the fifth, and there's many more, but to avoid simple solutions. Avoid simple solutions, or giving simple solutions like, okay, well, just eat this and then you'll get better, or just eat that and then you'll gain weight. And I'm saying this while I'm hearing my mom telling me that, like, just eat these fries and mayonnaise and you'll gain weight. It's like, no, it's not helpful at all. Or just accept yourself, or just do this. There is no simple solution to this. It's a serious eating disorder. It's a serious issue. So there's no simple solution. So avoid trying to offer these simple solutions. And now I'm coming to the things of to-dos, or recommendations, let me say it that way, because let's be honest, every single person is different and should be treated different and should be treated in their unique and personal way. So what I can say is this: be patient. These things take time. It's not about hurry and quick fixes. These things take time. So be patient. Be supportive. Be supportive. Like, I know it can be hard as a family member because you see things happening to your child and you don't get it, but it's so psychological and there's so much things going on that even the person with the eating disorder is not figuring out, is not realizing. So try to be as supportive as you can and help them get therapy. If you're a loved one or family member, we can't offer that therapy. You have to, you need professional therapy. So try to support them and direct them to a therapist. I think that is the best thing that you can do. And then stay out of the therapy and just, let it happen, but be supportive about the therapy. Then there is explaining your own concern. Like I was saying, avoid, pointing the finger and saying you, but explain what you feel. Like, explain, hey, I am concerned about you. I don't know what to do. Tell me, or let's have a discussion. Let's have a talk, and just be as calm as you can. Show your patience. So show your support. And one of the biggest things that I experienced myself is show love. Like, show that you love this person. If it's your child or a sibling, just show love. That's the best of all the tips that I can give. The best one in the whole series here, because the person is hurt, the person is struggling. If you have discussions or arguments, or asking for quick fixes or giving simple solutions, it's not helping. So, but if you show love, that's within themselves what they miss. They miss loving themselves. That's why they're hurting themselves with this eating disorder. There's, of course, I'm not going to talk about all the causes, but by showing love, they will, accept themselves more, love themselves more, and it's the best thing that you can do. And I know it can be really hard to be patient and supportive and sharing love and giving love, but it's really the best thing that you can do. And I think I'm done. I hope this is helpful, but bring on the questions and I'll just stop talking for now. Thank you.
Awesome. Awesome. I think that you did a great job kind of summing it up. And I think that Rachel took a great stance on that too. Sometimes when we're thinking about what we can do as family members and supportive people, helping people that are struggling with a variety